Welcome, everybody. So good to see you all here. I'm David Smith. I'm grateful to be the CEO of United Way for Greater Austin, and we are so glad to be here with all of you. Thanks for joining us. As you all know, all of us at United Way are so grateful to be partnering with all of our friends at Austin Community Foundation on this Together ATX fund. And we know that the huge success of this fund is because of all of you. So thank you for stepping up in a big way in what we all know is our community's hour of greatest need. I think we've all been seeing it and saying it for months now, but this COVID crisis put a spotlight on inequities and challenges that our community has been facing for generations. And because of your generosity, we've been able to offer together much needed relief to thousands of our neighbors here in Austin and in surrounding counties. So thank you. Today, you're gonna hear from Mike Nellis and Jessica Venson and me. We'll walk you through what we've done so far with the fund, share some of the impact of your gifts, take you into what we're doing with phase 3, talk about some of the data we're using, and then open it up to you all to hear from you and answer any questions you may have, and then close it out with some exciting news. So I'd like to ask Jessica Venson to introduce herself, and then Mike will introduce himself and start off sharing about the first 2 phases of what we've been doing with the fund. Jessica?
Hi, good afternoon, everyone. I'm Jessica Venson. I am the Director of Client Services for the Navigation Center at United Way. So I help oversee our 211 program, a behavioral health program, and a new program we just launched called Connect ATX.
Thanks, Jessica. Good afternoon, everybody. I'm Mike Nellis, and I'm the CEO of the Austin Community Foundation. And it's great to see so many friends on the call today. We appreciate you spending 30 minutes with us. We're gonna move through this presentation relatively quickly. And so if you have questions about anything that we've covered or things that we haven't covered, feel free to get in touch with either myself or David, and we'd love to be in conversation with you about it. Before I get started, I just wanted to thank our friends at the United Way for working with us on this fund. It has been a huge effort, but when we launched this fund in March, we knew that we could do more together than separately. And so that's why we decided to partner with the United Way on this fund. So if you could move to the next slide. What we wanted to do is just refresh your memory about kind of why we created this fund. Certainly the pandemic has had a huge impact on the region, and it was created to support nonprofits in the region, but most importantly, to those folks who are and have been disproportionately impacted by COVID-19. To date, we've raised just over $6 million, and we've distributed about $4 million from the fund. And when we initially kind of crafted the fund in March, the idea was that we would distribute capital in 3 separate rounds. We wanted to do this in 3 rounds because we believed that the needs would be rapidly changing in our community over an extended period of time. And what's been great about having 3 rounds for us is that we've been able to iterate and improve our process and hopefully our outcomes within each round. And then additionally, the benefit of working with United Way on this project is that they're able to bring 211 data to our process, which gives us real-time information about what's happening in the community. So I'm going to move on to quickly to what happened in round 1. For us, if you remember back in March when this started, information was moving quickly and data was changing rapidly day to day. So for us, round 1 was really all about speed. We clearly focused on basic needs and food insecurity in this first round. After talking with other funding sources in the community, we knew that there would be some overlap in terms of that, those funding areas, but we also knew that they would be focusing their efforts on other areas. So we kept that initial work relatively tight. We received nearly 300 proposals from nonprofits in the MSA, and the total requests came to about 4 million. But because we didn't know how much we were going to raise in this fund, we capped the proposal amount to $25,000. And so this is a good example of us being able to iterate in rounds 2 and rounds 3. So if you'll move on to the second slide, you'll see that the majority of this funding stayed in Travis County. While we know that we are becoming a greater region every day, we saw that the majority of the need was here in Travis County. So what did we learn from the first round? Well, we clearly learned that the need is immense and ongoing. The number of proposals that we've received, the stories that we've been hearing from partners in the community, it is shocking. The other thing that we learned was that we're a relatively small staff. The United Way is a relatively small staff. And so we brought in volunteers from the community to help review proposals, score proposals, and help make decisions about where capital should be deployed. But what really became clear for us and what the data showed is that Black and brown communities are being disproportionately impacted by this pandemic. And the need for this process to be centered on equity became really, really clear to us in that first round. And so as we moved into the second round, we started gathering more information, and we broadened the scope of funding, and a large portion of that funding supported digital equity in the second round. What we really wanted to do was to get a significant portion of that capital out the door before school started and support those institutions that were working on digital equity with families. We awarded about $2.2 million to 70 organizations, and we continue to see just extraordinary need. I think that the theme here is going to be the need in our community really outstrips what philanthropy can do at this moment. So what you'll see in the next slide is that largely this funding continued to focus on need in Travis County, although it has broadened out into the 5-county MSA. And then on the left pie chart, you can see how this money was distributed by organizational budget size. So those are kind of the two, sort of the very overarching results of the first two rounds. You can see more detail on the website of how capital was deployed. But David, I'm going to turn it over to you to really start talking about round 3.
Sure, thanks, Mike. So it's hard to imagine now, but if you can try to think back on when this first started, I think the general consensus is that we would be in a very different place than we are today. We initially thought that phase 3, round 3, would be all about nonprofit sustainability. So like Mike mentioned, focusing on those emergency needs right when the crisis hit and people found themselves unemployed and needing help with just basic needs. And we thought that we would be in a different place by now. And the reality, unfortunately, is that here we are in October, and there are still, like Mike mentioned so accurately, overwhelming and ongoing basic need requests. So that is what we plan to focus on in round 3. Ashley, I think is the next slide. Yeah, so I'm so proud. I know Jessica introduced herself, but I just want to say Mike and I both talk a lot about how incredibly thankful and grateful we are to work with just such strong teams at both Austin Community Foundation and at United Way. Jessica Venson is a perfect example of someone who I am in awe of, and to see the work that she does at 211 every single day is just mind-blowing to me. And the level of calls that we take there are staggering, and she manages all of that. And so she's going to share some with you all just about how this data informed where we are deploying this capital from Together ATX Fund. So Jessica, so good to have you here. Thank you. Mike and I agree that you're completely the star of this show and the star attraction. So definitely glad to have you here to share with everybody about the information we have from 211. Thanks.
Thank you, David. I appreciate that. Well, yeah, like I said, I really appreciate that. It's definitely the Navigation Center staff, our 211 team, that are the stars here and working really, really hard to answer all the calls that are coming in. I guess to kind of start off, just to give you a little bit of background pre-COVID, typical call volume for our 211 program would hover right around in between 8,500 and maybe 10,500 calls per month. So as soon as we became a point of contact for COVID testing information, and just because of the nature of what our 211 staff do on a day-to-day basis, which is providing information to basic needs, our call volume spiked. And we've seen a pretty consistent increase of call volume ever since March. While it has stabilized some, it's still an increase compared to what we would see previous years, same time frame, and then again, just pre-COVID. We typically, like I said, typically receive about 10,000 calls a month. But since COVID, we have seen about 85,000 calls since mid-March. I feel like there was, April, it was, almost, it was like 150,000 calls that we had received. So our staff are, there taking calls back to back. Our top needs tend to stay the same. And we've kind of seen that consistently throughout the last 2 to 3 years, where food security, utilities, rent assistance, are within the top 5 needs. However, in the last 8 months, COVID has moved into one of those top 5 spots. So COVID testing as well as ordinance information. And then unemployment insurance has taken that 5th spot. So, and that has, again, been the case since March. So it really hasn't changed. Through March and April, we've had the highest number of first-time callers, and that's in almost 20 years. We usually have about 10% of our call volume are new callers, or callers for the first time. And now it's about 33% of callers are brand new callers. You go to the next slide, Ashley. Thank you. So as I was mentioning, our needs have stayed the same. However, the raw number that we're seeing, and then in just proportion to all of our other needs, there's just been a huge increase. We still do receive, and I would say if we were to kind of broaden our top needs down to the top 10 needs, we still see childcare or calls for childcare, school supplies, mortgage, emergency shelter information, insurance, prescription as well. And so again, those needs are kind of still there. COVID has been the new one to enter into our top needs, but just the number of them has severely increased. Thank you.
Great. Jessica, I don't want to interrupt you. Did you have more?
No, I didn't.
Okay. Thanks. Thank you. I think you all can see how important that data is. And so as we planned for round 3, we went to these areas that you see that aren't a surprise based on what you just heard from Jessica, but food security, direct financial assistance, social supports, and then so the social supports is really about so many of us are isolated in these times, and for those of us who have a good, strong network of family and friends, we can all be grateful for that. But there's so many people who don't have access to that kind of social support. And so we are going to invest some of this money into organizations who provide ways for people to feel connected with each other and with the community, which I think is really important. And then of course, PPE. I think one of the things that Jessica hit on that is for me most staggering is that calls from first-time callers to 211 have gone up by over 300%. So if you think about the number of calls we used to get from people who are calling for the first time going up that dramatically, I think it just gives you an indication of, again, why we continue to see the level of need that we see in our community. So I think, Ashley, you can go to the next slide. Yeah, I was gonna say, I think the next thing is Q&A. Mike and I think we already have 2 questions lined up. Mike, I think you got the first one.
Yeah, so what surprised me most about this work and this process, I think you hit on it earlier, David, which is the longevity of this has been a surprise for me. I think in March, I thought that we'd be back to school, back in our offices, like back to work, back to normal, right, by now. And certainly we aren't there and we don't have this under control. The pandemic has really laid bare the inequities in our community in a big way. And as we look at that 211 data, I think that we see that this is going to have a really long tail. And so I'm projecting that the impact to our community is going to be significant for a long time. What's been really impressive to me is that I think philanthropy has played an important role in supporting communities. And I think that all of you on this call showed up, which is amazing. You showed up and supported folks with dollars and otherwise. So thank you. But as these inequities become deeper in our community, my hope is that philanthropy is going to continue to show up and we'll step into this even more. I know lots of us have moved beyond some of our own thinking about how we fund and who we fund. And my hope is that we will continue to do that as a philanthropic community. So those are some of the things that I've been thinking about.
Thanks, Mike. So I got the second question, which is, what does the long-term sustainability of the nonprofit sector look like in our community? And I think, Mike, in your answer you just gave to the other, there are a lot of similarities in the answer I would give to this question. This has drawn out so much longer than any of us could have anticipated. And what that means for our nonprofit sector is that they need our support more than ever. The nonprofit sector in our area is doing fantastic work, and we just need to keep stepping up as a community to support them. I wish I had a crystal ball and could tell you what it would mean for some individual nonprofits. I think there could be some nonprofits that don't make it through this, and that's unfortunate. But I also hope that we can, like Mike said, come together as a community and decide together that we are going to be here for those in our community who have traditionally been underserved and who have traditionally, and I'm talking traditionally generations and generations, have not had access to the same opportunity that so many of us have. And so I hope that those who survive this level of crisis will reevaluate, like Mike mentioned, how and who we fund in a way that is more equitable. So I don't know that my answer is all that illuminating, but I think with how long this is drawn out, it's the best way I know to answer. And so we wanted to open it up for questions from you all. Again, your voices are important, and we want to hear from you. Anything that you want to know more of or hear from us more. Anybody have any questions?
I do.
Hi, Samantha.
Is this a raise your hand or just a talk? Hi.
Go for it.
I was just wondering, in this capacity that the two of you, the two organizations have been working together, like how has that been, and what do you see as sort of future opportunities for that kind of collaboration?
It's been awful. Working with David Smith is just horrible. Sam, I would say that what we had hoped to get from this was to, one, create some more efficiency within the philanthropic landscape and a little bit of organization. The idea of coming together to be able to do more. Certainly what we know is that some of the nonprofits at this point are having a little bit of application fatigue. And so we wanted to try, by coming together, we wanted to try to sort of ease that burden a little bit. But I do think that it sets the framework and a platform for us to do more kind of crisis recovery work together, because there's already kind of, we've sort of built this playbook. But also I think that there's opportunity for kind of additional programming and work that we can do together beyond crisis work in the future.
Perfect answer.
Thank you.
Yeah. And I would say too that, clearly Mike and I don't get along. And we were talking before COVID and before this fund. We did a joint fund around Hurricane Harvey that was a great success. And that was such a good experience that we came together on this one as well. But Mike's right, it won't end with just crisis support. I think that we are seeing in many different ways that we can have more impact together. So I think that's important. Thanks for asking that question, Samantha. Raul, did you have a question?
Yeah, of course, it's a data-related question, but really, I mean, I guess I'm just curious, with the experience y'all have had, if there's going to be any kind of report back of sort of the impact, right, or of the awards, and then if we could look at that to see if, again, if anything stands out as an innovative approach or a program that has had such greater impact maybe than other programs or other approaches than maybe we have seen in the past. And so it's more of an offer to, if there is an interest in looking at the investments and the impact of this investment, certainly keep us in mind over at CANYA.
Yeah, hi Raul. Thanks so much for the offer, and I think that that's going to be a really important part of the sort of unfortunate closing of the fund when we're done and the capital has been distributed. I think we want to learn what we did right, what we didn't do right, and how we can do it better next time. And we will make all of that sort of public on the Together ATX website.
Yeah, but thank you all. I mean, it's an incredible effort sort of from the entire community. And so thanks to everyone who's supported the fund. And certainly if there's future appeals, you can also count on us for that too,
Thank you, Raul. Thank you. Anybody else have any questions? We love hearing from you all.
Hey, I'll ask one. How you guys doing? But that was not it. I think a lot of the people on this call are funders too, right? Around this work and others. So, I mean, are there things that y'all learned that maybe you were surprised by in this process, or any tips you'd offer to those of us that are in the check writing business to make us all a little bit better about it?
So for me, I would say one of the things that we endeavored to do is to reach out to hear from voices that don't often get heard in our community, and to get as close to the folks who are being impacted by the pandemic as possible. I think in philanthropy, we often are a little further removed. And I think it's been really important and instructive for us to, one, make sure we're hearing those voices, but two, to include them in the decision-making, those voices in the decision-making process.
That's exactly what I would say too, Jeremiah. I mean, so for those of you, Jeremiah has served on the United Way board, so is very familiar with what we do, and we have very close relationships with hundreds of organizations all over town. And still, I would say I learned, similar to what Mike just said, that there are many with whom we don't have relationships that we now do, and that are doing really important work. And so their voices are just as important. And so that expansion of listening and really hearing from people who are either having lived experience or are kind of boots on the ground is really, really important. Yeah, thanks. Great question, Jeremiah. Any other questions? Do we need to, oh yeah, I guess we do need to wrap up. So,
sorry, just a very quick question. It just piggybacks a little bit on Jeremiah. Just given the longer term prolonged nature that we're all dealing with right now, do you see making the appeal for a sort of extension of Together ATX, or maybe some of the insights from what you learned will, to Jeremiah's point, give us some guidance on in terms of where we should direct more dollars after round 3 is closed to really support the longer term sustainability of the community?
Amy Bell, that is an amazing segue into the next slide. Your timing is impeccable. So we are, we're on the final stretch here. We've got round 3 in process right now. And so we're excited that the Chef Sangreal Foundation's made a $1 million match available up through Thanksgiving, which means that we could potentially get this fund to $8 million by the time that we are done. So if you're thinking about how you might do more, this is a great way to leverage your dollars. It's a one-to-one match, and you know, we feel like it could have a big impact. Going from 6 to 8 is meaningful in our community, and so think about that as an opportunity to potentially do more and leverage your dollars up. We're going to be working our process, and we're going to announce the last round of grants in early December. And I think that this match, you know, I think the design of this match is that, and likely all of you are feeling some of this, which is there may be a little bit of philanthropic fatigue right now. Folks are being asked to do a lot, and we're hopeful that the match opportunity can infuse a little energy and get people to think about giving again. And so you'll see more about that. So that's sort of what's next for us. So any other questions before we close? I want to be respectful of everybody's time. So I just wanted to thank everybody for really for your deep commitment to this fund, to stretch in the way that you're giving, and your commitment to this community. I know many of you on this call, and the work you do is extraordinary. And there is still so much work to be done. And so know that the folks at the United Way and at the Community Foundation, we're rolling up our sleeves, and we're going to continue to work. If you have questions about the fund or anything that we've covered today, or have ideas, please don't hesitate to contact either me or David. We'd love to answer any questions you might have and be in conversation with you. So I just want to thank everybody for spending 30 or so minutes with us today, and we hope you all have a great day.
Thank you.